realization that woke me up one day as to what was wrong with healthcare and what we needed to do differently. I was in the last month of my residency training in Minnesota at Abbott Northwestern Hospital, and I had been on call all night, and I sat down at the foot of his bed only because I was tired. And I watched as every specialist came in and grabbed the chart out of my hand and went into the room and dealt with the machine that dealt with the defective body part. And it was that day that the light bulb went on that my patient wasn't diseased and fragmented, but the system was. So I went home that night, and on the top of my mail was a picture of a man in an interview that they had done on him, and he had written a paper over 50 years ago, How to Build the Most Healing Hospital in America. So in my sleep-deprived state, I dialed 411. He'd gone to retire to Hawaii. He answered the phone. I said, I'm Dr. Duffy. I would love to help you build this hospital. And he laughed. He said, it's only a dream. I've come here to hang out in a hammock. That lasted about 2 weeks. His name is Earl Bakken. He invented the pacemaker and founded a little company called Medtronic in my backyard in Minneapolis. And he and I have been on over a 20-year journey to try to humanize the way we deliver medical technology. That led to my role at the Cleveland Clinic as the nation's first chief experience officer. But he calls me every couple of months and says, Bridget, healthcare is still so broken. What are we going to do about it, and how can we go faster? And I will be flying to see him in January for his 94th birthday, where he will be honoring 10 patients who have an idea to change the world and make medicine better. He had the idea when he read their annual report that for every implantable device, it extends the person's life by 4 to 6 years. And he said, what do they do with their extended life to improve humanity? So here they are creating global patient voices as a force to do good for the world by changing medicine. So MedX, we're partnering with them at this event to extend the reach and the voice of those patients. But so what happens in healthcare, all of you, as we go back to our jobs on Monday, the whole country and the world is focusing on what I call the leanification of healthcare, stripping out waste. Now it's the appification of healthcare. It's also customer service, telling doctors and nurses to work harder, faster, with less money. Now look up, smile, and be nice to the patient. That's not what it's going to take. What it's going to take is people like you in this room, partnered with MedX, where we change the way fundamentally that we engage patients in the design process. I just attended an incredible design event that was wonderfully done, but what happened is we engaged the end user, as they called it, at the end of each of our design sessions. So we brought the patients in after we'd already carried the innovation forward, and it didn't work. Patients looked at us and said, I don't quite get it, or I'll need time to think about it. So the only way to change medicine is to change the way we engage patients. The opportunity, just by way of example and just to make a statement about how broken healthcare still is, how many of you in your organizations still strip people of their dignity and respect and put this on them when they walk through the doors of your institution? Because of one patient, when I started at the Cleveland Clinic, we flew to New York, and I sat down and met with Diane von Furstenberg. She walked in and she said, why are you here? All these doctors and hospitals in New York want me to redesign the gown. I have no interest in doing this. I said, why not? And she said, I hate hospitals. I said, why? She said, they smell, they're scary. I said, I'm asking you to help me restore dignity, empathy, and respect back to healthcare. She said, now this I'm interested in. So she re-engineered and redesigned the gown. Unfortunately, it's not widespread yet, but we're making a dent. Second patient that helped open my eyes to the fact that this should be done differently, we were redesigning the orthopedic experience, and he raised his hand and he said, Dr. Duffy, I go across the street to your competition in between my high-tech appointments here. And I said, Jerry, why in the world do you do that? And he said, because over there they treat me like a human being and they understand how my disease has impacted my life. He said, you never once asked me my greatest fears and concerns. And I said, Jerry, if I asked you that now, what would you tell me? And he said, after my second open heart surgery, I had a seizure, and you took my driver's license away for 6 months. He said, I was afraid you'd take it away for life. He said, cars are my livelihood, my legacy, my independence. So a couple weeks go by, and we overnight put on the medical record and on check-in at every clinic and hospital, the first question asked is, what are your greatest fears and concerns that you would like your care team to address? So over the night, because of one patient, we can change the game in healthcare. A couple weeks go by, he calls up to my office. I talk to him, I go, Jerry, what's the problem? You need help navigating, getting an appointment? And he said, no, I'm just calling to check on you. How's that car working out? I had purchased a car from him. And I said, oh no. I said, please tell me after your 2 open heart surgeries that we called you back to check on you. And he said, no, you didn't. He said, would you like me to join your advisory board? I have a few ideas on what you could do different. So in closing, my hope is, and you just heard about the vision, the mission, and the purpose for why MedicineX exists with this amazing team that's leading it, is that when you go back on Monday, you'll do 3 things. 1, you'll disband your patient and family advisory councils. And number 2, you'll create and embed a patient experience design fellow in everything you do in your organizations. Today, the councils, we come in and we have them rubber stamp the design of the lobby. We do not engage them effectively. So my hope is, lastly, third, that we invite you at MedicineX to engage us in a way that's meaningful for your organization, so that together we can change healthcare globally by truly listening and engaging patients differently in the design process. Thank you so much.